Toronto's top doctor had been calling for a stay-at-home order, which included closing non-essential businesses. The province has now done that, but she and other local medical officers of health had called for further restrictions. For instance, they wanted the province to impose travel restrictions between regions. They wanted the province to legislate paid sick days, and they were hoping the province would close schools where outbreaks were significant. They're not implementing any of those measures. Still, in a late press conference this afternoon, Dr. Eileen de Villa said taking these steps is better than doing nothing at all.
I support any and all solutions that achieve the objective of measurably weakening the disruption that COVID-19 is forcing in all our communities. Our job now is to respect and follow those measures. We do not have enough time, nor do we have enough vaccine to vaccinate our way out of this third wave.
I welcome the fact that the measures announced today do try to address some of the unfairness that has existed as between small business owners and big box stores being able to sell non-essential items over the past number of months. I know that the latest shutdown, if you want to call it that, is not what anyone wanted to go through again. We're working harder every single day, as I've tried to evidence today, to get these vaccines into the arms of those who need them the most.
The mayor says he does support the latest stay-at-home order and it will save our summer. During the shutdown, he says the city will be racing to get people vaccinated, especially essential workers and vulnerable residents in hotspot neighborhoods. In fact, in some of the city's hardest hit neighborhoods where essential workers do live, any adult 18 and over will soon be eligible for a vaccination at a pop-up or mobile clinic. One ER physician in Toronto we spoke with says prioritizing essential workers is the correct next step, but he's skeptical another provincial stay-at-home order will work.
We have done this before and we're doing it again. We're not taking care of essential workplaces. So workers are still going to get infected in large numbers because those places aren't closing. What we're seeing now is younger people in their 20s to 50s now severely ill. They're getting sicker faster than before and they're not protected. They're being thrown into workplace situations where they don't have a choice.
And of course, starting today, all of Toronto's schools were closed. Dr. de Villa saying that schools did remain safe, but the action taken was to keep them that way. She emphasized that the priority is to get students back in the classroom as soon as possible.